Good morning and welcome back to another episode of Preserve Health Talks. This morning I am pleased to have one of my business partners here in the studio with me, Nicholas Junjulas. We set up primary care practices, direct patient care practices, concierge practices throughout the United States, and we're launching into the dental market as well. And we have a lot of fun doing this, but a lot of doctors don't know about it. So as an engaged audience this morning, I want you folks out there to be aware of what we do. And I want doctors and dentists who are watching this show to be aware that we're available for you so we can set you up as well. So let me start with this. If starting a concierge practice or a DPC practice is such a great model, why do so many physicians either never start it or fail when they try on their own?
Well, I think they never started. There's a lot of reasons. One is they don't even know about the model. They hear about it. They might know people who do it, but they really don't know a lot about the model. So it's only a small percentage of physicians who are doing this right now. And the other reason they don't start, a typical reason would be just the intimidation factor. They have a secure position now, whether they're salaried or they're a partner, and it's risk to switch and start a practice. So that's, not everybody's willing to do that, to take the risk. The reason some of them fail is they don't really have a plan. You have to have a plan when you start a practice. You need to have your cash flow. You need to have financing available. It's a process, and the more you plan, the less likely you'll fail.
So let me segue then into saying, do you think most physicians actually understand what they're getting into when they say, I'm just going to start a concierge practice on my own?
Yeah, some may, but I think most don't. They don't understand the model. They don't understand how to attract patients, how to keep patients, how to set up the office correctly, how to manage expectations. There's a lot of things that go into a successful launch of this type of practice. And, physicians are trained in medicine and they're good at that. But from my experience doing this for many, many years and setting up hundreds of practices, they just don't know the business aspect. Smart people, but it's just not what they're trained for.
So I would guess then that the biggest misconception, at least that I hear over and over again when people call us to set up, is why would anyone want to pay me as a doctor to take care of them when I can just go through insurance, I can go to a walk-in clinic, and it would cost me less? And my answer to them for that misconception is, you're getting great care. You're getting 24-hour availability. You're getting an experienced physician. I've been in practice 41 years. I've been licensed in Florida since 1985. And I think most people are relieved to know that they have me in their back pocket. So here again, the biggest misconception that I hear over and over again is, why would patients want to do this? But I think most patients really want to do this if they can afford to do this. And that's why we, in my practice at Preserve Health, we always keep a small waiting list of patients. We try to work our way through that waiting list, but it's something that's needed as medicine becomes more difficult to navigate the system. We actually advocate for our patients, and I think patients really appreciate that. So one of those things that looks simple on the surface is setting up these practices, but it's actually operationally a little bit more complex underneath. So I want you to walk through in just a couple minutes what we do for our clients.
Sure. So, the first thing we do is we divide things up into phases. And the first phase, we want to go through developing that plan. So what are you going to do, how you're going to do it. We want to look at things like, what are your operational costs going to be? Everything from staffing, malpractice insurance, lease payments, all of those types of things. So we get your cost down, and projecting those costs is not hard. If you do it regularly, you know what those typical costs are, and they may vary by geography. We've set up practices in New York City, rent is high. Beverly Hills, rent is high, but sometimes it's in the Midwest and the rent is low. So you have to adapt for the market for some of the costs. But you start with the operational cost, and then you look at what is the revenue going to be, and the revenue is going to be what are you going to charge monthly? And that again can vary a little bit by market. So we want to make sure you're charging the appropriate amount. And then if you want to bill insurance, we'll factor that in. So now we have your operational cost and your revenue, and we grow your revenue. You're starting a practice, so you're not going to have the full patient panel on day one. You'll grow it. So we grow your revenue, and then when we're doing your setup costs, we look at things like your clinical equipment, how many exam rooms you're going to have, what type of equipment you're going to have. We give advice on all of that. And then what are your soft costs? Very important soft costs, for example, marketing. You must spend money on marketing. You must have a great website. You must have a tactical marketing plan. A tactical marketing plan is all of the ways you're going to attract patients. And there are many, but not all of them are as good as others. So we're going to come up with a plan for that. And then we're going to take you through financing. And a lot of physicians, again, they've never gone through financing for medical practice. We know it inside out. We like 100% financing. We like interest rates, typically a little below market because you're a physician. We can get you those kind of rates, and we make sure you have enough working capital, very important. And that's all wrapped up in phase one. And then we also look at real estate. Okay, so real estate, you don't need a lot of space, 1,200-1,500 square feet, and the typical layout, the waiting room, reception area, a few exam rooms, office, things like that. We look for space, and we help you negotiate the lease and get that down. Then once all that's done and we get your financing, then it's time to start the actual launch of the practice. And it's just a management of a plan that we have. It's got about 85 steps. You do them in order. And the model for success is all in the planning. And that's what we've done over and over again. We know how to avoid the mistakes. That's it.
So the biggest issue that I've seen with other doctors, and let's be honest, doctors are used to figuring things out on their own. And why doesn't that approach work here? And just to put it simply, because they don't know what they don't know. I've been in a practice for years. I've got patients coming in, and they're assigned to me through an insurance plan. Well, not so in this model, because in this model, and you've already mentioned that you have to do a lot of marketing in this model in order to be successful. You're not assigned patients in an insurance plan. We need your insurance in order to bill for labs and x-rays and for specialty visits. But these practices are very transparent because we charge a membership fee, and we help physicians determine what that membership fee should be based on the demographics of their area and the cost of living in that area, and what it's going to cost to run a practice in that area. So when physicians are figuring things out on their own, that approach doesn't usually work here because they really don't know what they don't know. And as far as contracts, we provide the patient agreement contract. We provide HIPAA compliant information. We provide an employee manual. And it's so unbelievable how many practices we've set up where physicians will ask, why do I even need an employee manual? Expound on that a little bit about other things that we do that physicians think they know, but they really have no clue as to what they're doing until they get into that 86-step plan that we provide for them, and we walk them through that. But what are the other things that I'm leaving out here?
Yeah, so one of the things that a physician would know, so they've obviously had some loans in their life, whether it's to fund their education or to purchase a house or purchase a car, but have you ever borrowed money for a business? Probably not. So you don't understand what's an appropriate interest rate. Do you have to put money down? How much financing do you need? What should the term be? What's the advantage to a longer term and a shorter term? So we know all of that. A physician would not know that. The average person would not know that, and simply because you've never done it. So that's where we help you. And if we could get an interest rate that's a little lower for somebody, that they would have no idea that they can get interest rates, say in the fives, or a 10-year term and 100% financing, that's fantastic.
True.
Most people would never know that that's even out there. Other things, when it comes to real estate, have you ever looked into setting up a practice? Have you ever dealt with commercial real estate at all? Because that's what this is. You're setting up your office and it's commercial real estate. So do you need tenant improvements? And the tenant improvements are where the space is not where you need it. So you maybe need to knock down walls, put in flooring, paint. It could be just cosmetics, or it could be a full build out. Maybe it's just shell space. Are you aware, for example, that the landlord will pay for part of that? Probably not. And if you don't ask, they're not going to offer it to you generally. When you're negotiating a lease, are you aware that the landlord will offer a free rent period called rent abatement? Again, you wouldn't know that if we didn't help you with that. And then when it comes to things like marketing, you probably never marketed a practice. So many things you can do, and it's so important. And with us having done it over and over again, we know what works. We've seen what works. Marketing can be very expensive, and some marketing people charge lots and lots of money, and you don't get results. So we can guide you on that.
And these are very expensive mistakes that sometimes are very difficult to reverse, if at all. Imagine paying $5,000, $6,000 a month rent and not realizing that we can get you 3 to 4 months, perhaps rent free, while you are either what we call building up your practice or ramping up your practice, or during a build out if you need tenant improvements. The other thing that a lot of physicians don't realize is that the landlord may be willing to pay 30% or more, sometimes even up to 100% of tenant improvements.
Yep,
and so that's why if you use a consulting company like ours, the Juniper Advisors, we walk you through the process. In fact, sometimes when clients say, I've done half of this on my own, I only need you for steps A, D, X, Y, and Z instead of A through
Right.
Z, it's more difficult because we're backing people out of expensive mistakes that they've made already.
Correct.
And it might take longer for them to set up. Rather than a shorter period of time. We can usually get people set up in about 4 to 6 months. There are 3 rate limiting steps that I always like to talk about with my clients when we set them up. And one is a bank loan. It takes a while to get a bank loan. 2, opting out of Medicare. Practices like mine are opted out of Medicare, and CMS, Center for Medicare and Medicaid Services, only allows you to opt out the first of every quarter. So if you're not opted out, then you're obligated to bill. And then if you're billing, then you have to be credentialed. And all of that takes a lot of time. And the third rate limiting step is the build out. We try to get people into what we call Class A properties with minimal build out. But sometimes it requires an extensive build out, and sometimes those build outs can take as long as 6 to 12 months. You wouldn't know that unless you talk to a group like us, correct?
Yeah, exactly. Exactly right. Yes, and even in vendor selection, so you may find online a company, for example, that sells exam tables, and the price looks great, and then you go ahead and commit to that, and you buy your equipment from them, and then the next thing you know, Oh, well, yes. Well, delivery is another, 20% on top of that, and then we're just going to drop it off in the front of your building. You need to get it up into your office space. So, you can make mistakes like that. Whereas vendor selection, the people we would choose, they'll not only deliver everything and it's included in the price, but they'll set it up. There's a great warranty, and it pays to work with experienced people. And that's just one example. You're going to be picking out companies for all types of things: telephone service, EHR, billing. You're going to have a membership. How are you going to bill for that? Are you going to try and set up QuickBooks and do it yourself and have the burden of every month sending out statements and seeing who's paid and who hasn't? There are vendors that do that for you at a fraction of the cost that it would cost you to do it yourself. And that's where our experience comes in. And it saves you money, it saves you time, and it will let you focus on seeing patients, which after all is what you want to do the most. And you will find it way more satisfying to do this. You'll have more time with patients. Patients will like it because they have more time with you. And there's nothing that's going to pop up for you that we haven't seen before and can solve.
Physicians are constantly being tested during their training, and they're constantly being boarded and reboarded. And physicians have a horrible fear of failure, much more so than any other profession I've ever worked with. That fear of failure sometimes is almost paralyzing. And I think that's what doctors are really afraid of when they're sitting on the fence about making this move into, a concierge or DPC practice, is what if I don't make it? Mm-hmm. But when you use a organization like ours, and we've set up together probably close to 70 practices now, mm-hmm. and you've set up over 100 on your own before I joined you as a partner, I think that with our proven strategies, and by the way, guys, I don't mean to be bragging about this, we have a 100% success rate. None of the practices that we have set up have failed. They've all done well. Some practices take longer than others to set up. In other words, if you have a patient base to draw from, then you'll be more successful than if you're coming straight out of residency. It might take longer to achieve that same level of success. So I think the fear of failure, both financial failure and the fear of this isn't going to work, nobody's going to want to pay me out of pocket, is an erroneous fear, and we try to get people over that. So I don't think the fear is mostly financial. I think it is deeper than that, and I think it goes back to who we are as doctors and how doctors' minds work. So let's talk pricing.
Yeah, well, I could add a little bit on what you were just saying. Okay. So there's, what's the motivation? So there's fear. Fear can be a motivator. The fear of a practice of someone not being able to be successful in this is one thing, but I think look at why you want to do this. I think it's really important. And where are you now? What's your motivation for doing this? Are you burnt out? Are you tired of seeing 25 patients a day, being on a treadmill, having bosses that don't let you choose your staff or how you're going to practice? What is it about where you are now that's making you think you want to switch? And where will you be in 2 years and 5 years? And maybe your career's got another 20 years left. Where will you be if you don't do this? You need to think about that as well. And in these models, although it may seem intimidating, you don't need a lot of patients to be successful. Okay?
About 300.
300 patients, and generally you will be earning more. Okay, almost always with our clients, they earn more, and with 300 patients, obviously much smaller patient panel, way less responsibility, and just your typical workday, if you've got such a small patient panel, you're not getting interrupted all the time with labs and critical values and having to schedule things. You really can enjoy practicing again. So yeah, the financial aspect is one piece of it, very, very important piece. But the other piece is your lifestyle, okay? Now maybe you go in at 9 and you see your last patient at 4 and you don't work on Fridays. You're available to the patients, but it's not the same grind. And we just see people who go from where they were when they came to us and where they are after, and they're universally happier.
The other thing that I see is that physicians tend to undervalue themselves. They're used to being paid on an RVU basis, which is a relative value unit basis. And so you're paid for ordering tests. This model gets rid of all that. This model doesn't pay you for ordering more tests or for treating sicker patients. You make more money than well patients. This model pays you for providing good care because it's based on a membership fee. And that membership fee can vary. I've seen them as low as $1,800 a year, and in New York City I've seen them as high as $30,000 per patient per year. I would like to think that the average in the United States right now is somewhere between $3,000 and $5,000, and we've certainly done our demographics on that. But I think that physicians still tend to undervalue themselves. I've got patients that think nothing of paying $30,000 to $50,000 a year to play golf every day.
Right.
Okay?
Right.
But I'm not going to spend a couple thousand out of pocket to take care of something that could be life-threatening. So I think that on both a patient perspective and on a physician perspective, we have to go back and realize what's important. And I think that there's a happy medium there. And we try to help our doctors that we set up find that happy medium based on average pricing in the area and what works for them. And then marketing.
Very
Because
important.
it's not the old saying that if you build a better product, they will come. Or if you build a better mousetrap, they'll buy it. That's not how this works.
No.
It works with marketing on what you do, marketing on how you're trained, and marketing on what services we're able to provide. Closing statement?
Well, yeah, so closing statement, and again, add to what you're saying. The other thing to realize with these practices is, so if you're employed right now at a hospital or you're with a group and you're not a partner, when you leave, you don't have anything. In these practices, you have a guaranteed revenue stream. So that makes this practice valuable. Way more valuable than a typical primary care practice. Businesses are valued based on the revenue stream. And you can sell this practice way more easily to another physician in some states like Florida, where we operate out of, although we do all 50 states, but our office is in Florida. You don't have to be a physician to buy one of these practices and to own it. Florida is one of those states that allows the practice of corporate medicine. But the point is, you've got something valuable when you're done that you can sell to somebody. And you don't have that if you're just working for another organization. So what I would say about this is, again, I've said this earlier, but the most gratifying thing for us is what we see when we're done is the physicians where they were and where they are down the road after working with us and having their own practice, just the level of happiness and how much better they feel about what they're doing. And that's what's the most gratifying thing about this.
Sure. So, end of show here. Can I do this? Well, I can because I've done it. And we've set up multiple practices. But for you, if you're interested in doing this, give us a call because I think you can do this if this is what your dream has always been. So the real question and the closer is, do I want to get there the hard way and try and reinvent the wheel on my own, or the smart way by calling someone like us, the Juniper Advisors, to get you set up and going? It's been a pleasure. We'll see you back on the next episode of Preserve Health Talks.